foster hope in the children and families that I serve is meeting children and families where they are, allowing them to remember that they do have a place in this crazy world that we live in, and that things are not as hopeless as they seem.
Family bonds are one of the most important things in a person's life. With the work I do in the GAP program, I'm able to keep children and families connected.
I think we're all a huge important piece of the puzzle to inspire hope for all of our children.
Welcome. This is such a privilege of an opportunity to speak to you as we begin and open our first inaugural virtual summit here in Brevard County. I'm so proud to be a part of a community that is so engaged and so focused on the vulnerable children and families that we work with here in Brevard County. You know, our hope for Brevard County is so broad and vast. One of the things that we all think about here in child welfare is the hope that we give to children who have experienced adversities towards a life and future that will be received with unconditional love and acceptance. Of course, we want them safe and we want their well-being needs met, but we want them to live within perfect and harmonious families that are there to nurture and grow them so that they have all the liberties and opportunities to be the individuals they are. So when I think of hope, I think of the child that we're all touching. But I don't stop there. I think about the families that we engage, whether they're foster, adoptive, or bio families, and I think about the hope that they receive the kind of gratification that they are changing lives forever, and the kind of gratification that they get in working with children who need to heal. And then I think about the workers, caseworkers, guardians, therapists, and you'll see later about how therapeutic interventions with animals have had impacted children's lives. And then I think about the organizations that Brevard Family Partnership and its family of agencies collaborate with throughout Brevard County for the greater giving hope to the community at large that we will together unite in harmony in a way that will change the community engagement, the whole, how would you say, layout of the land with regards to how communities come together during very adverse times, unprecedented times like COVID, and they realize how they can communicate through many a modality that affords us in this day and age of technology. This virtual summit will be a one-of-a-kind event and experience that we hope that you roll up your sleeves, your virtual sleeves, and be a part of engaging and being engaged. So in the coming months, in the coming years together, whether we have to fend ourselves around a COVID experience, I want you to understand that we as a community of professionals, a community of caring people, a community of faith-based engagement, are here for the greater good of our children, their families who are struggling, the community that surrounds them. And together, the hope is that we unite for a very long time for the greater good of our vulnerable children families here in Brevard County.
Hi everyone, my name is Sharon Washington. I am the Regional Managing Director for the Department of Children and Families here in the Central Region. And it is a pleasure for me to welcome you all to Brevard County's inaugural virtual summit on child welfare. When I think about our mission, when we think about the system of care and social welfare, child welfare, we certainly understand that the department certainly cannot do this alone when we look at serving our children and families. We understand that it is only done through a collaborative effort with our communities, with our key stakeholders moving forward. And so our relationship that the department has here locally with BFP is one that I'm certainly proud of. Our philosophies align in that we understand the importance of working together continuously in ways that we can find ways to enhance service delivery and ensure that our families are receiving the services that they need. the continuum of care is one that starts at the hotline all the way through to case management. And we understand how the actions of us on the front end, our investigators on the front end, the work that we do on the front end, how it impacts our services and case management on the other end. And so if we do good quality work on the front end, it certainly will equate to good outcomes for our families as it relates to services when you move forward within the case out in the community and with our lead agencies. My philosophy here as regional managing director, and what we talk about often, is being willing to do what is right all of the time, understanding that we should never settle for the status quo, that we should always be looking for opportunities to enhance our service delivery to our children and families. They deserve that. When you think about our mission and why we are here, it is to ensure that we keep kids safe, that we're able to service families so that they can be whole on their own without needing any intervention from any of us. And so, it is something that I take to heart, that we understand here on the ground locally, working in partnership with BFP, that our respective teams, that we're always willing to come to the table, ensure that we're doing what is right for our families. This pandemic that we find ourselves in with COVID has thrown some unique challenges at us. And I think one thing that I'm certainly proud of, I would think that Phil Scarpelli, our CEO at BFP, is also proud of, is that we have continued to ensure that we're providing critical services to our families. We have not wavered. We have taken this opportunity to be very innovative in how we deliver our services, ensuring that safety has been number one, but we've not wavered. In fact, when we've looked at our performance has actually increased as we've gone through COVID in a lot of areas versus decreased. Now we know there's been a lot of different things that have occurred, but the commitment to continue to move forward is what I'm most proud of, even in the midst of the pandemic that we find ourselves in. And so I think that is absolutely critical. One of the sayings that we talk about here with our local team, and that I think most of us would say, when you look back on certain crisis situations, they are painful, but usually a lot of innovation is birthed out of crisis. And so we are an innovation-driven agency. It was one of the first things that Secretary Popple created when he took office. We have an innovation team. We understand that in order to move forward, we have to be innovative. That we can't remain stagnant, especially when you think and look at a mission and what we're all called to do and what we have the privilege of doing in serving children and families. One of the things when we think about the Secretary's priorities, we are focused on moving from a crisis-driven agency to a prevention-focused agency, a human-centered prevention-focused agency. And really, there are two key areas that we have been focused on as it relates to that actual goal. And it is really centered around how can we increase pre-crisis contacts. We know in various arms in our system of care that families touch us. How can we, at those points of entry that they touch us, service them in a way that prevents them from moving into a crisis situation? So one of the key pieces is to increase our pre-crisis contacts. And the other arm of that is at the point that families do enter our system of care, how can we ensure that we are servicing them in a holistic manner to make them whole, right? Make them healthy so that they do not re-enter our system. And so as we have worked through this within the department, we've looked at various approaches and opportunities and ways that we can actually accomplish this. And under the pre-crisis contact umbrella, one of the ways that we are moving forward and as a system, and so not just the department, but working in collaboration with BFP, all of our lead agencies, all of our providers, our community stakeholders, is really looking at how can we really implement care coordination. How can we ensure that at the points that families touch us, that we're doing a key assessment and linking them to services based on their personal needs, based on the community needs. What will that look like? Every community is not the same. I think that's the beauty, even when we think about community-based care and ensuring that we are adjusting and being flexible to what each community needs moving forward. But we're moving forward with linking to Aunt Bertha, which is a referral services. It has a plethora of services identified in it by which investigators, child CPIs, APIs, our team members in economic self-sufficiency, our case managers will have the opportunity to link families to critical services, right, in order to fill any gaps or prevent them from moving further into crisis. Another key component of the pre-crisis intervention and also even moving into the aspect of when families have entered our system is the engagement of our faith-based community. This has been a priority for the governor. It's a priority for the secretary. It's a priority for the department and our entire system of care, because our faith-based community, they are already servicing families in a manner that aligns already naturally with our mission. So there's natural alignment there. And so we are moving forward with introducing a care portal network that will allow faith-based communities to tap into what those unique needs may be by family and to fill those needs as their resources will allow. And so we are truly excited about moving our system forward, understanding that it takes all of us to be able to service our families holistically. And I think that's when I think about what we do, I think that's what I'm most proud of. When you think about collaboration, when you think about the more individuals, the more organizations, the more individuals that you have that are looking at opportunities that we have to better service families, it's kind of a no-brainer. The department cannot do it alone. We understand our role and we understand how important it is to link all of us to be a participant in the linkage of ensuring that we can move forward with service to families. And so as you all move forward, as we move forward with this virtual summit, I am truly excited about what will come forth as we continue to explore what some of our policy changes will have and how it will impact child welfare moving forward. So I hope that you all enjoy, and thank you again. Take care.
Hello, I'm Circuit Judge Jennifer Taylor. I preside over the Dependency Division in Brevard County. Thank you for being here from wherever you are. Although this seminar has now turned into a remote presentation, it remains my privilege to be with a group of people whose passion is to keep families safe and provide a permanent, more hopeful future for children in Brevard County. Although we cannot gather as we normally would, the pandemic has made it even more important that we do gather. We serve children and families in crisis, and the important work we do must continue. I want to start by sharing with you some of the good news from Dependency Court. In accordance with the Florida Supreme Court mandates and the support of our Chief Judge, Lisa Davidson, we've continued to hold court proceedings. While most participants attend remotely, many parents are attending court in person. We've been able to use technology to improve our courtroom resources. Although about 50 times a day we still say the screen is frozen or unmute your microphone, nevertheless, we continue to set full court dockets, serving families and meeting statutory milestones due to your ongoing work behind the scenes. This also includes the work you're doing to resolve cases by way of agreements, to reunifying children with their parents, modifications to visitation, and other important issues. You are all communicating openly with each other. And you're communicating at all hours of the day. I have orders being submitted by email, late nights and weekends, so I know you are working more and more flexibly from your various locations. I'm happy to report that despite the most challenging of circumstances, many parents are excelling in their case plan tasks. They are participating in family counseling, batterers intervention, and anger management, and many more programs. Families who are challenged by a lack of transportation and don't have a support system to get them to the location of service providers are now able to access them through remote means. And parents who were irregular in their visitation are seeing their children through remote visits on a more consistent basis. And let me tell you about remote adoptions. We are continuing to place children in forever families. We have held Teams adoption hearings attended by friends and family members with the same emotion, laughter, and tears as in-person hearings. So please don't feel that your efforts are for naught, because the hard work that you're putting into these families continues to show results. With Florida's coronavirus cases continuing to climb, we will all need to work together to navigate the difficult challenges to come. Here are just a few of my observations on what we need to help ensure the health, safety, and emotional well-being of children in our care. First, get creative. There are ways to get things accomplished even with limited resources. I've been amazed and inspired with the innovative ways our child welfare professionals have continued to stay on task. Second, think long-term. Keeping children safe means planning for the worst-case scenario. Pandemic restrictions may be here for a while. Until there's a COVID-19 vaccine or more effective treatment options, we may be living in the new normal. This means rethinking how we manage our role in the child welfare system. And remember, children perceive time differently than adults. A few weeks or months in limbo may seem like a much longer period of time to a child. It is a great source of stress and anxiety. And third, keep the faith and stay safe. Child welfare professionals are first responders, ensuring the stability, safety, and well-being of vulnerable children and families. This already challenging job is now further complicated by the COVID-19 pandemic. And I want you to know that I miss you. I miss those of you who would typically appear in court with me every day. Case managers, child protective investigators, attorneys, guardian ad litems. But I have been able to visit your dining rooms. I've seen your patios. I've seen your kitchen tables. I've even met your cats and dogs. And you have mastered the one-armed shush, stopping children and spouses from interrupting your remote court attendance. If we are able to take care of the most vulnerable members of our community, we need to take care of ourselves and each other. Heed the CDC guidelines and follow protocols to stay safe and stop the spread of disease. In the difficult days ahead, we will need to continue to find ways to engage and empower our families. Let's also find ways to support each other whenever and wherever possible. Together, we can do this, and I will see you soon.
When I look at the system of care here in Brevard County and all the community partners and all the tremendous work that everyone does here, it really reminds me that you're changing children's stories every day and fostering hope in our kids and in our families all the time.
I work a lot with families that are homeless. Just seeing their little faces go to a place where they can say, it's mine, this is my bed, this is my room, or this is my little corner, to me, that's like I did something great, just providing that little bit of help and that little bit of resource to get them into a new place and get them out of the street or sleeping from a car or sleeping from a park. That's a big impact to me personally.
I like to think of it like a jigsaw puzzle. So when a case comes in, it's kind of broken up a little bit, and we, along with others, take each piece of the puzzle and put it back together to make it whole again.
Great community to work with, and everybody has the same goal of doing what's best for these children.
Hello, my name's Carol Jewell, and I'm the Circuit Director for the Guardian Ad Litem program.
The Guardian Ad Litem program is made up of volunteers who advocate in the community and in court for our children. Typically, they only have 1 or 2 cases, so they can focus on the individual needs of each child. The volunteers work side by side with the child while they are in dependency court. They listen to them, they advocate for them, and they make sure that that child does not get lost in the system. Sometimes our children come into care with little material needs. The Guardian Ad Litem program can help there also. Friends of Children of Brevard is our nonprofit, and they can help with material items, normalcy activities such as camp, dance lessons, and sports activities. Friends of Children of Brevard is also made up of volunteers, Guardian Ad Litem volunteers, and community advocates who work tirelessly for children who are going through the dependency system. Volunteers are ordinary people who make an extraordinary difference. I have a couple of quotes that our children have said about their Guardian Ad Litem. One child said, "The Guardian Ad Litem listens to me. They're there for me. They hear what I say, and they make sure that my voice is heard." End quote. Another youth said, "I didn't think much of it when my Guardian Ad Litem was appointed. I'm used to fighting battles on my own, but my Guardian Ad Litem was there for me, by my side. She really helped me work through the dependency system. So now, when I think of a Guardian Ad Litem volunteer, I know there are good people out there, and it's okay to let them fight by your side." Volunteers also work closely with the Guardian Ad Litem attorney and a child advocate manager. We call them CAMs. CAMs are board certified advocates who make sure that the volunteer has the resources and the ability to advocate for their youth. The program attorneys are also a big part of the team. They meet constantly to make sure the children's needs are met. And a large part of our advocacy occurs in court. Our Guardian Ad Litem volunteers make recommendations for visitation with siblings and parents, for permanency outcomes, and for services that are needed for the child. Brevard County shares a common goal of reunifying children. The Guardian Ad Litem program, Brevard Family Partnership, Family Allies, and the court system all work together to make this happen in a timely and safe manner. If this can happen, it is the biggest accomplishment our programs can do. The Guardian Ad Litem program has 5 core values. Collective empowerment, which just means we can make advocacy decisions at a local level. Courtesy, commitment to children, communication built on trust, and collaboration. We try every day to work these goals with our community partners. To paraphrase our executive director, Alan Abramowitz, we own the outcomes of our community partners. If we can help them reach their potential and accomplish their goals, it is the best outcome for the children. Therefore, our ultimate goal is achieved. So, to Brevard County, thank you for being part of the dependency system. You work tirelessly every day to make a difference in a child's life. And I thank you, and it is a pleasure to work with you each and every day. Now, I'd like to introduce my regional director, Kim Delgadio.
Hi, my name is Kim Delgadio, and I'm the Central Regional Director for the Guardian Ad Litem program. I wanted to share with you some of the initiatives we have going on with us this year and last year. Last year, we had over 10,000 volunteers who donated over 343,000 hours of their time, driving nearly 3 million miles to visit with children and to go to staffings and to go to court. And we represented over 38,000 children. We have some really exciting things going on. Last year, we initiated the Triumph Award, which was made possible by our Florida Guardian Ad Litem Foundation to recognize youth that are in foster care who are continuing their education. We picked 3 finalists throughout the state, and each one got a laptop and a scholarship. And luckily this year, we have even more support, which is going to allow us to increase the amount of scholarship for these youth. And we're very excited to be able to continue that program. Another thing that I would like to share with you is the educational opportunities that we have available to us. We are working with our community partners. We had a trauma-informed work group that helped us to identify trauma-informed practices And we had many experts in the field come and do webinars for us and help us educate ourselves on trauma-informed care. And now in our warehouse for all of our training opportunities, which is called the I Am for the Child Academy, we have many trainings and courses available for people to come in our program and outside of our program. So I invite you to go to our website, guardianadlitem.org, go to the training and resources page, and click on the I Am for the Child Academy. You can find courses in educational advocacy, legal advocacy, commercial exploitation of children, many other topics related to child welfare. We're in the process of finishing up a 4-part series on substance use disorder and addiction with Ginger Ross. And we have just started a new 4-part webinar that has to do with strengthening resiliency and preventing vicarious trauma with Corinne Edwards, who's a therapist out of the Gainesville area. So really excited to have those opportunities and to be able to share those with everyone in the community. Something else that has been really exciting for us this year is that we are going to be able to certify our child advocate managers, the same people that Carol was just telling you about. Our child advocate managers are our staff who work with, coach, mentor our volunteers. Sometimes they have cases of their own where they're actually working directly with children, but they're a very important part of our advocacy team. And this year, we've been able to work with the Florida Certification Board to certify them, just as case managers and CPIs are certified. So we, in conjunction with USF, created a training for our CAMs to go through, and they will be taking a certification test within a year of employment. And then just as case managers and CPIs have to go through continuing education, they're going to have to do that as well. And every 2 years, they're going to get recertified, and they need to follow the same code of ethics as the Florida Certification Board holds for everyone else. So we're hoping that this will raise our level of professionalism throughout the state for our CAMs, that consistency in training for all of the CAMs will help improve our advocacy and our representation of children. Those are the main things that we've been working on and we're really excited about. I wanted to thank the Brevard County System of Care for allowing us to come and talk to you today. It's really a pleasure for me to be here, as this is where I started my career in child welfare over 20 years ago, and I still live here, although I travel throughout the state. So it's always a pleasure for me to come home and be able to meet with all of you. And thank you again for having this summit. And I would like to introduce you to our managing attorney, John Hubbard.
Thank you, Kim. Again, my name is John Hubbard. I'm the managing attorney for the Guardian Ad Litem program for Circuit 18. Within our program, we have 5 attorneys in Brevard County who handle all the cases that our program is appointed to. Their role within our program and within the system is that within the program, they're part of the advocacy teams. So we have a child advocate manager. Hopefully we'll have a volunteer guardian ad litem. We don't have them appointed to all cases, but in the ones that they are appointed, they are part of this decision-making team. So we have the program attorney, the CAM, and the volunteer, and they discuss each case, decide what sort of actions need to be taken on a case, discuss any issues that are they foresee or that are present, and decide a course of action. As far as within the system, our program attorneys attend all the court hearings. They represent the program and advocate for what we believe is to be in the best interest of the child or children that are in that particular case. They provide legal advice to the team as well as to the program. And the type of advocacy that you would see from our program attorneys is that, say, maybe a motion to change placement. They will be asking at various hearings, are there additional services that the children or child need, such as do they need a mentor? Is there counseling services that we need a referral for? There are other services that our volunteer or CAM has identified when they've been meeting with the child or children. So we'll advocate in that way. Sometimes it may be to push for a different permanency goal than the departments or other partners within the community are seeking. We may file a termination of parental rights petition as well and prosecute that. But our program attorneys work hand in hand, typically with the Children's Legal Services, the attorneys there, as well as the parents' attorneys. They're in constant communication in and out of court, and we're all trying to achieve permanency for these children within the 12-month time frame, or as quickly after that as we can. But it's always been a pleasure to be in this community. Like Kim, I've been working in this field in Brevard County for over 20 years now, been on different sides of the fence in here, and it's just, everybody works very collaboratively in Brevard County. It's just a pleasure. It is just a great community to work with, and everybody has the same goal of doing what's best for these children.
Well, thank you, and I want to thank Brevard Family Partnership for an opportunity to come and talk to you today. My name is Dr. Jason Wiesler. I'm a psychologist by trade, but my job currently is working at Circles of Care as the Executive Vice President. My role is in charge of operations. Circles of Care has been around for about 56 years in Brevard County. We are a private not-for-profit, and we have many different areas in which we serve the community. We have inpatient services, which we're probably best known for. That is our Baker Act receiving facilities. We have 148 beds inpatient, but we have a variety of other types of programs too. These include residential programs for mental health, residential programs for substance abuse, in-home services, in school, and a variety of other types of programs. What I'm here to talk about today is our medication-assisted treatment program, which is paid for through a federal government grant called SOR, or State Opioid Response. This program serves people who suffer from opioid use disorders. Opioid use disorders are very common in our society right now. In 2018, we lost about 46,000 people nationally to opioid overdose. In Florida, during that same time period, we lost about 3,100. Now, in Brevard County, we are averaging roughly about 90 deaths per year, but that does not include deaths that come by way of suicide, through accidents that happen because of opiate usage and whatnot. So the problem is much greater than that. We spend a lot of money each year on the problem. It affects nearly every part of healthcare. Opiate use disorders are very common in the criminal justice system as well, and of course in the child welfare system. So the State Opioid Response grant money allowed Circles of Care and to partner up with Brevard Family Partnership to provide services for people that are in the child welfare system. They can be referred to the program at any point in the child welfare system, whether that be on the front end when they're first identified, or if there's custody issues down the road, they can be referred at any time. As the name implies, medication-assisted treatment utilizes medication to assist in the treatment of the individual. There are 3 different types of medications that can be used to help people with an opiate use disorder: buprenorphine, naltrexone, as well as methadone. And I'll cover each of these very briefly. Buprenorphine is the type of drug that is used to help people who are experiencing opioid withdrawals. These withdrawals are very uncomfortable for people. In fact, if you think about it, most people don't continue using drugs because it makes them high. Most people use drugs to avoid the consequence of no longer using drugs. Their dependency has gotten to a point where they may not even get any enjoyment out of that activity. So this particular medication allows people to stop using drugs and not experience the horrifying withdrawal symptoms that have kept them from becoming sober before. I like buprenorphine because it is introduced or induced as soon as you start to experience some very severe opioid withdrawal symptoms. These are very uncomfortable symptoms that people experience: clammy skin, all sorts of withdrawal effects, You can become physically sick and nauseous from opioid withdrawal. And you're able to utilize this, and it almost immediately starts to help them stabilize and medically get to the point at where you're able to interface with them. You can talk to them about the nature of their problems and where they're going to go from here. There's some consequences of using buprenorphine. Some of the challenges is that it has to be in a controlled setting and with providers that are watching out after the person. Otherwise, it can be abused. You can take too much of it and get high. You can also divert the medication. Many times people will take their medication and sell it on the streets because it has a street value. So these are all attended to by regularly monitoring the person, doing drug screens for other types of substance abuse problems, and to make sure that their dose is stabilized and that they're using it appropriately. Another medication that we use at Circles of Care is called Vivitrol. This is also, the generic form of it is called extended release naltrexone. This drug is nice because it is not a narcotic. It's a medication that gets in your body. In this case, it's a shot that you get once a month. It lasts for about 30 days. And when you have taken the shot, what it does is this medication gets in your system and it blocks all of your opiate receptors. So if you were to relapse, then what would happen is that you would not have the perception of getting high. It provides a very important component in that it prevents the person from getting the reward for the behavior that they were doing before. That is, if they cannot get high, what's the reason of doing drugs? So it assists people in that area because yes, it does affect their withdrawal symptoms a little bit, but more importantly is it prevents them from getting the reward and starting that cycle of use and abuse over again. Some of the side effects of naltrexone, there are very few. It's very safe for most people, but it is expensive. We do receive some money through the SOR grant to help pay for some doses of naltrexone, but our waiting list is pretty long for that service. It does cost about $1,300 per month to receive naltrexone, extended release naltrexone. But as far as the pros are concerned, it's a very effective drug. One nice benefit of naltrexone, extended release naltrexone, is that it also works on alcohol abuse as well. So people that are taking this medication can't get drunk. Now that doesn't mean you can't overdose, because putting a lot of substances in your body is horrible for your body, but you're not going to be high while you experience the overdose. The third medication that's used very regularly is methadone, and methadone has been in American society for about 50 years. And we, as Circles of Care, do not use methadone, but there are well-established places in the community that serve people with opiate use disorders and methadone. The challenges with methadone is that it's very tightly regulated by the state and by the FDA. We have programs that are very, you have to present very regularly for your doses. There's very close monitoring, and there's a very rigid style program, which is an excellent program for a number of people. It's not for everyone, but if you can tolerate that level of program, methadone has served millions of people throughout the years. So there are local community places that offer methadone for folks with this type of disorder. I talked about the medications, but now I want to talk a little bit about the team members. You can't expect to just throw a medication at someone and expect that their life is going to change. The real work happens behind the scenes. It happens in therapy. It happens in the person's life when they go back home, the decisions that they make. And we have, through part of this SOR grant, a team of people that surround the people with different types of services that help them meet these kind of needs and help foster the change that they're looking for. There's a therapist that provides individual counseling and different types of group therapy. Probably most importantly, they're there to identify the needs of the person as they evolve through the treatment process and their treatment planning process. We also have care coordinators that are able to help people navigate the complex world of social services. They might be eligible for benefits, but they don't have anyone to advocate on their behalf, or they have no idea how to manage this system. And so they will meet them not only in the office, but in the field to help them get access to resources that can benefit their life and their family's life. We have, as of course, if there's medication involved, there's a physician or nurse practitioner that's working with them directly. And it's not just provide a script and see you next month. These are active relationships that are ongoing with the treatment provider. We have nursing services. Many folks that have opiate use disorder have other health concerns that interfere with their ability to function or to live. They have chronic pain conditions many times. There's other, like liver problems are very common, and other types of heart problems that can result from chronic use. And so this nurse will help have everyone on the treatment team, including the providers that are external that are managing their other concerns. They help everyone get on the same page so that we all know what's going on with the person. And finally, and perhaps most importantly, is the recovery process is very heavy on the utilization of peer services. These are people who have lived the experience, that they know what it's like to be in recovery. They know the challenges that befall them. They know how to get out of sticky situations and when to provide the types of help. And that's because they've been down that path before. So peer mentors or peer support specialists, they receive training to apply their knowledge and their wisdom, having been down that road, to the people themselves as they're going through that. So all of these people come together as a team and work with the person to promote, the general well-being and their ability to get back on recovery. Circles of Care is a recovery-oriented system of care. What that means is that there are many paths to people's recovery. There are many things that can help people depending on the perspectives that is meaningful to them. For instance, let me give an example. In tobacco addiction, you can ask a person, how many times did you quit? And they'll likely tell you, well, I've quit many times before I was able to actually make it stick. It's very individual. You could ask the person, how did you quit and what methods did you use? And these methods would vary pretty dramatically, actually. And you could ask them what motivated them to quit. And they might say, well, their answers would be as varied as the people themselves. So if that's the case with tobacco, then with opiate addiction, the reasons for people to quit are endless. There could be legal issues. There could be issues, in this case, with the child welfare system. There are personal reasons. There's the family issues that they're going through. Their needs are varied. In the past, we had a model that was a medical model that said, here's the right treatment, and you have to fit in this model. Currently, we have a system of care, a recovery-oriented system of care that respects the individual needs of the person and puts them at the center of their treatment. There are many paths to recovery, and having the person able to access those paths at the time at which is needed is what really makes it the most effective. And that's the system of care that we've established in this particular program through SOR. Brevard Family Partnership and Circles of Care have worked together to try to streamline referrals to our medication-assisted treatment program. And this is done through a SOR specialist on Brevard Family Partnership side. This person works directly with the court system, with the child welfare system, in a variety of contexts to provide efficient referrals over to our program. And we receive those referrals and process those referrals in a very expedited fashion. We also have added additional peers and in-home services for folks who are in the child welfare system in some capacity, but have difficulty making appointments due to transportation issues. Brevard County is a very large county. Many people struggle with having access to transportation services. And so many times we can provide services that are actually in the home. We can go and meet them in the community or with the family members at a setting that's a little bit easier for them.
My name is Avril Dennis. I have the privilege of working with Dependency Advanced Behavioral Health here in Central Florida, overseeing some of the residential and community programs. And more importantly, this year is Eli. Eli is my partner for animal-assisted therapy, who is helping us start a pilot project at Devereux. Animal-assisted therapy goes way, way back. Florence Nightingale is quoted as having said that a small pet is often an excellent companion for the sick. So there's an awesome opportunity for me to connect with kids and with staff by talking through the dog or talking about the dog. So some of the things with adolescents that we talked about is using him as an icebreaker, relationship building, socialization, right? So it's great to see kids work together and socialize and work together with the dog. Education, touch. You can also use the therapy dog as rewards. So we've got kids who, if they do well in treatment, if they do well in school, we had a little bit of a challenge with some kids not coming back from school at one point. So we made sure the therapy dog was there when they returned from school, and if they came back from school, they got to spend some one-on-one time with him. Playing with the animal can decrease anxiety, can decrease social anxiety. It gives the kids and the staff something in common. I always love when I have a kid turn to the staff and be like, "You like dogs too?" And then they've got something in common. A lot of our kids in group care or congregate care don't have extraordinary opportunities for touch. So Eli likes to be touched, so he would lay here and let a kid just scratch his belly like this through an entire group, right? They're not judging kids. They're not judging kids' mental health issues. They're not judging kids' speech issues. They're not judging whether or not kids are liked by other kids. So that's really, really important, particularly for kids who have some mental health issues and who are seeking treatment at some of our facilities. So it's really important. It also teaches a variety of things. I've always told people never to get into animal-assisted therapy if you can't talk about sex education, because kids will ask lots of questions about sex education. It teaches patience because we ask kids to help train the dogs or teach tricks, right? And sometimes it takes patience, and it teaches responsibility because they need to learn sort of what's required for the dog. So he needs a break, he needs some water, he needs to go outside to go to the restroom, things of that nature. Teaches kids and staff how to care. It improves morale amongst the staff. And it's interesting because the program director over at our Orlando site is one of those people who has a genuine fear of dogs. But he'll stand back and see the positive for the staff and the kids and completely support the program. There are several things that you want to be careful of if you're doing animal-assisted therapy. Lots of people have some pretty significant fears of animals. I have some pretty amazing stories of people who have overcome their fears just by the therapy dogs. But that's not really the goal. We don't set out to have people overcome their fears. We want to respect their fears. Allergies are another big issue. As you can probably see, Eli's shedding a little bit, even though he was well groomed prior to coming. You want to be careful with people's allergies. And allergies and fears, I always talk about together because people are more apt to say they're allergic to dogs than they're afraid of dogs. So we need to be really respectful of both in the same way, because it's easier for people to say that. People misunderstand dogs' behaviors sometimes. So I had a therapy dog at one point who used to purr, and it almost sounded like growling. So she would get this low guttural purring going when someone was scratching her, and they'd be like, "Oh, she's growling at me." So you want to make sure that people understand, or that you understand your dog's behavior and know their stress. During the pandemic, we were doing virtual visits with the kids because the kids had relationships with Eli already, and they missed him. So we started to set up these appointments to do virtual visits, and engaging with the dog in a virtual visit has some challenges. So what would happen is the kids who had been participating in training him all along started challenging me to teach him things for next week, and then I would have to report back and show what he had learned next week. So they came up with some very creative things. And one of the things that they asked to do is to have them learn how to take the socks off. So Billy volunteered to see if he'll do it for you.
Why not?
And it's interesting because that is actually a task that we teach service dogs, and Eli was raised and trained as a service dog. So he had never learned that. So the kids were absolutely tickled when he learned to do that. So what I'm going to have you do is I'm just going to have you loosen your sock at the ankle just a little bit for him, since he hasn't done this for you yet. And then I'm going to point him to your foot, and I'm going to ask you to wiggle your toes when I tell him to get it for you, okay? He will nibble around, you'll feel his teeth, but he's pretty good at getting between your toes to grab the sock. He hasn't really bitten my toes yet, so we'll see if he does that. Eli, you want to take off some socks? Come here. Come here. Look. No, Eli, I know those are treats. Go, get your socks. That's it. You get that. Okay, now put your foot out. There you go. Good. That's it. You get it, Eli. Tug. That's it. You get it. That's it. Tug. That's it. Yes! Good boy. Bring it here. Thank you. There you go. You want to get the other one? You get that. That's it. Good boy. You get that sock. Good boy. You get that. That's it. You tug. That's it. You tug. That's it. You get that. Yes. Good boy. That's it. You get it to Phil? No, you're going to drop it. Nope. Not your chew toy. Bring here. Thank you. Good boy. Yeah, good boy. So that took about probably 2 weeks to teach him fully because, obviously I'm actually working. But the kids were just thrilled that he learned how to do that. So over the years, there's been a number of really cool opportunities and really cool stories. But I remember one of my first early on when I was doing animal assisted therapy was a young man who was in the equivalent of our SIP program, and it was closing in on the holidays, and he wasn't able to go home for the holidays. His brother was able to go to a foster home, and he was really very sad, but not real verbal about it. And he used to use, I was a therapist in the program at the time, and he used to use my office with the dog just as like 5 minutes away from the milieu to kind of regroup and come back together. And he came into my office for what was one of his routine visits back to my office, and the dog I was working with at the time, Jaguar, wasn't feeling great. She was going into heat. She was kind of in a funk, so she wasn't up to playing with him. So he kind of laid belly to belly, nose to nose with her, and processed his entire inability to go home for the holidays with her. Just being really empathetic. And he was like, don't worry, Jag, it's okay. Miss Avril and the staff will make sure that you have a good Christmas, even though you can't go to your family. And this isn't really a bad place to be. And I've heard that they get presents on Christmas morning, so it's all going to be okay. And the people here really care about you. And I'm sitting at my desk, a fairly seasoned therapist at the time, like fighting back tears because this kid is completely processing everything that we've been trying to get him to talk about for weeks, about not being able to go home and not being able to work with them. So it's really, really incredible. And again, no human therapist other than the handler present for that one. But that was really an aha moment early on in animal assisted therapy for me of, wow, like what the kids will talk to the dog about, but they won't talk to us about, the lack of threat in talking to the dog about them. And then more recently, it's a lot of fun because, we'll bring the dog over, and we've got 2 dogs in our pilot project. So himself and Beretta, and he and Beretta look nothing like each other. Beretta's a Neapolitan Mastiff. She's gray. He's a Lab Golden mix and yellow. But the kids will start asking if they're related, and how they're related and how they know each other. And then they'll tell you about a dog they had way back when. And then you find out that it's a dog from a foster home, So as the kid starts talking about the dog, you start hearing about these important relationships that the kids had, because it's never just about the dog, right? It's about how they were treated in that home, and it's about how they felt valued in that home. Or you hear about a cousin or an aunt or an uncle who had a dog that you didn't know existed in this kid's life, and suddenly you've got another link to another adult in our kids' lives, because those extended family members frequently get lost when kids enter our system. So it's really interesting to sort of watch where kids take the conversations when they're talking about dogs. So those are a couple of examples of things that sort of really, sort of warm my heart with this. It's a really great way for me to be grounded again, and sort of why it is that we do it.
You don't want your disability to define who you are. When I'm in the water, I'm not stuck anymore. I'm not confined to this. It's healing and it's empowering. After my accident, I spent about 27 years out of the water. Getting back to the ocean, it really just brought me back to exactly who I am and where I'm supposed to be in my life, and it's right here. My name is Charles Chaka Webb, and I am a mentor for Urban Surf for Kids.
Here at Urban Surf, we do surf mentoring and surf therapy with foster youth. A lot of these kids get moved around, but the one consistent thing in their family is us.
The first time I met Destiny was at an Urban Surf for Kids paddle camp in Carlsbad.
When my foster mom introduced us to each other and got that connection and that bond going, it immediately it was there. A lot of white water, I'll be good.
You're used to that, right?
Nothing big.
Talking to her and hearing her story, sitting there totally emotionally unprepared to hear a child tell me that she's been, abused by her father, and I cried. You can break your body and that's recoverable. But to hear a child say that and to see that that hasn't broke her, how could you not be affected by something like that? How could you not see the strength in this kid?
I didn't think anyone would miss me if I were gone, but he showed that he would, and he was so consistent, and that's something I had missed in my life, was the consistency of a father figure, and that's what he was. He told me I was his warrior princess, someone who was strong and brave and courageous.
It gives me a lot of joy to know that she can look to me. I'll never let her down. I'll always be there for her. And I know in my heart that I can hold that promise. I can deliver that.
So my name is Steve Payette. I joined Urban Surf a few months ago. The idea is really to work with water therapy, bring the kids on the water, teach them how to surf, forget about all their problems, their troubles, their daily struggle, and just get on the water and forget everything. Water therapy is really the goal of this program. We have two swim teachers that are willing to help us out. That's awesome. That's a great start, but we need more people that can get on the water with the kids and just teach them how to swim, teach them how to surf, and just mentoring the kids and have a good time with them.
Good afternoon, everyone. What a tough act to follow, huh? Fortunately, we have a dynamic, exciting panel who will be talking to us this afternoon. Just briefly, I'm Kelly Swartz, and I'm talking to a camera, which is weird. What I'd like to do is ask each of our distinguished panel members to tell us a little bit about themselves. We'll start with Alan Abramowitz, because that's
two A's, so alphabetically, he goes first.
My name is Alan Abramowitz. I am Ben and Irene's favorite son, and I'm the executive director of the statewide Guardian Ad Litem program and advocate for children, and I'm with a great panel. I feel like Forrest Gump here with these people, but go ahead, next person.
Let's go to Representative Roach.
Good morning. Thanks for having me. My name is Spencer Roach. I currently represent House District 79, which is eastern and northern unincorporated Lee County. I've been an active, member of the child welfare community now for probably going back 15 years. Started as a volunteer for Big Brothers Big Sisters, graduated into the Guardian Ad Litem program, which I've been doing now for about 5 years. And last year I got my foster care license, and I'm having my third placement right now as we speak. So happy to join you.
Thank you, Representative. Representative Williams, can you please tell us a little bit about yourself? Oh, you may be muted.
Hear me now? Is that better?
Yes, yes. Thank you.
Okay. I am Patricia Williams from Brevard County, State Representative for District 92, a foster parent, guardian ad litem, appointed member for the cabinet for the state of Florida, and I've been fostering about 20 years.
Thank you. Candace Brower.
Hi, good afternoon, everybody. I'm Candace Brower. I'm a board certified juvenile lawyer, and don't let Alan fool you because so is he. They started board certification for juvenile lawyers in 2017, and we were among the first to become board certified. So we're really proud of that. I've been representing parents and children for over 20 years. I'm the vice chair of the Juvenile Rules Committee. I'm on the Dependency Court Improvement Panel, and I've been the regional counsel for the first DCA region of Florida since I was appointed in 2016. But I've been a dependency lawyer for and a juvenile lawyer for the regional counsel's offices since they opened back in 2008. So happy to be here.
Thank you, Candace. Zachary Gibson. Muted. You're muted.
Good afternoon. My name is Zach Gibson. I'm the Chief Child Advocate and Director of the Governor's Office of Adoption and Child Protection. I serve as a member with Representative Williams and Director Alan Abramowitz on the Florida Children and Youth Cabinet, and our office administers the statewide faith-based and community-based advisory council. Thank you so much for having me.
Thank you for being here. And by no means least, but last is Phil Scarpelli.
Good afternoon. Can you hear me?
Yes.
Oh, I'm sorry. Good afternoon. I'm Phil Scarpelli, Chief Executive Officer for Brevard Family Partnership. And I'd be remiss if I didn't begin by thanking Alan Abramowitz for putting together this distinguished panel. Alan, you're a longtime friend and colleague, and we are grateful to have you with us today. I've been around since the inception of privatization. I was part of one of the earliest pilots in the state of Florida. And it's been a long journey, and I'm just so proud to be a part of this panel of distinguished individuals. So thank you.
Thank you, Phil. And thank you, everyone, for agreeing to be on the panel. I'm going to start with some questions. The first question is for all the panelists. As leaders in child protection, each of you play a role in influencing legislation and policy. What are each of your key priorities for the upcoming year as it relates to system reform? We'll start with Representative Williams.
Okay, one of the major things that I would like to work on this year would be a career path with you would pair them off, mentor children off with people in different professionals where their interests are, to actually start forming a partnership so that they'll start believing and feeling that they belong to something, to form a partnership in the community where they actually see professional people that's making a positive impact in their lives and also in the community. that will actually help us grow as a society.
Thank you. Representative Roach?
Well, good afternoon again. Thank you. And, in the question, you had mentioned legislative and policy, but the sort of the third and perhaps the most important arm of that is budget. And, I don't know if you saw that the Commerce Department released their report this morning that the U.S. economy shrank almost 33% between April and June, and EDR released their report that, and this is not an estimate, these are hard numbers, that we have a revenue loss, a general revenue loss in Florida of almost $2 billion. So I think that the rest of my time in the legislature, whether it's just a few more months or several more years, is going to be characterized by an environment of budget austerity. And so I think that's going to be something that we really have to think about in terms of, before we even get to system reform, I think we're going to have to really focus on system stability in the budgetary process, because, the challenge in this is there's always a disparity between the amount of child welfare that I and perhaps Representative Williams think that we need, and how much the Florida taxpayers are willing to pay for. So that's something we're going to be working to balance out, to make sure that if there are cuts, they are as least harmful as they can possibly be. And in terms of system reforms, in that same vein, I think that one of the things I want to look at is, trying to achieve a parity and equity in per child funding across the state. I think the model of the money following the child is a good one, but I don't think, for example, that a child in Miami should be funded more than a child in North Florida or in Lee County. So I think we need to work on parity and per child funding across our CBCs.
Thank you, Representative. Zach?
Hi, some of the priorities we're focused on is primarily focused on prevention. And when I say prevention, I'm looking at prevention from a three-tiered approach of primary, secondary, and tertiary. Our office works very closely with the Department of Children and Families in supporting all levels of prevention, but our office has a primary focus on the primary and secondary prevention strategy. So how do we bolster our statewide efforts around primary and secondary prevention that can begin to minimize entries into the child welfare system? Additionally, I think about the work that the governor has certainly spoken a lot about, the engagement of faith and community-based organizations. How do we continue to develop partnerships and win-win opportunities that really satisfy all Floridians across the state, but also to those that may be involved within our state systems?
Thank you, Zach. Alan?
Yes, I'm going to piggyback off what Representative Rhodes said. And earlier today, you heard the Regional Director, Sharon Washington, and Judge Taylor. And they talked about, Judge Taylor, about technology. And Sharon talked about getting the families sooner. And, Brevard County has been a leader in that with Brevard Cares. And I think we need to start focusing our legislative attention on where are we wasting money in the system. Just last year, we had a bill that almost passed that would have saved $2.5 million for the department that dealt with adoptions. We have an administrative procedure and then we have a judge procedure. And no matter what happens, it still has to go to the judge. By eliminating the administrative procedure, we save time for permanency and remove a bureaucratic part of our system and allow the case to move faster. And when Judge Taylor talked about technology, we're learning a lot about telehealth and these other ways to be more efficient. We need to latch onto them. We need to look at legislation that gets rid of bureaucratic obstacles for getting children permanency or getting children home. And we need to maybe invest more in programs like Healthy Families Florida that keeps families together. Because a parent that's motivated, we need to help. We need these parents that are struggling, and we know we're going to have more struggles, but we need to be able to be there for them because it's going to be costly, not just in money, but for that child to have the trauma of coming into care.
Thank you, Ellen. Candace?
Thank you. Yeah, I mean, just like Representative Roach said and Alan said, the first priority is always budget, unfortunately. I was very pleasantly surprised when I learned in this position that I could have an influence on policy I was also so grateful to Alan for sort of showing me the way and including me in some very significant legislation that directly impacts Chapter 39, which deals with dependency in the area of law that I have devoted my entire career. So rather than just being sort of on the periphery, I have in this past session tried to be more involved in coming up with any legislation that would protect children by helping to secure and defend the rights of parents, because children fare better when they stay with their parents. So just like Zach said, with legislation focusing on keeping the children in the home is going to be better overall for the children's futures. So that is a great place to start, and I will be involved in all of that. But the budget, especially now, certainly we can't function without it. We were created to save money, and we do that. And we've created expert lawyers in the dependency system. And better representation for parents equates to better outcomes for children. And I think we've been able to show that and prove that over the past 12 or 13 years. So we're hoping to be able to keep doing that. So it's not just the fact that we save money. We actually were able to create these specialists that have helped children along the way. So that will be the priority, is focusing on that and making sure the powers that be understand that.
Thank you, Candace. Bill?
Oh gosh, I could echo everything that was just said. Let me look at a different angle. Yearly, my team and I go to Tallahassee and we talk in front of the legislature. And what we do is we talk about impact, and we have foster and adoptive families come with us, and foster and adoptive children come with us and tell their story of success. And the success is all predicated on what we're all talking about collectively, and that is the impact when systems are funded adequately. I'm concerned, certainly. We are working within a complex system. We are working with very complex families. And then we have things like the 4E settling, right? The sunsetting on the 4E, the family first requirements, all of which is necessary. I understand the direction and evolution, but we do need to advocate, and I will continue to advocate, that funding core issues around mental health and substance abuse is critical. It is the downfall of society. It's the downfall of families. So we've got to figure out ways to influence legislators in the sense that what is a greater priority? Let's think about that. And think about what we can do by building stronger families, who in turn build stronger communities, who in turn create economic strides that cause societies to thrive and contribute back. So there's so much we can do. I also wish to platform a lot of things around the protection with our PIs and our caseworkers in the field. The last thing we need is critical thinkers in the field anxious about their own safety when assessing the safety of children. I want to see critical thinking ramped up to this high level of functioning. And I tell you what, this whole COVID experiences has caused our organization and my fellow leaders to reevaluate the impact of efficiencies in how we do what we do. And so what we're going to look at in the coming months and years is to figure out how to make the most of limited resources. But we can't do that without continuous and relentless advocacy that mental health, substance abuse, and child welfare funding has to be among the highest of priorities in next session. Thank you.
Thank you, Phil. This question is primarily for Phil, Alan, and Candace. However, anybody else can respond to it as well. So the Family First Prevention Services Act will be a major change agent in reforming the child welfare system. How do you think the new legislation will improve the system? And part two, what do you foresee as the challenges? We'll start with Candace.
Start with me. Okay. Thank you. I love the idea behind this legislation, which is sort of shifting the focus from paying people when children get removed, as opposed to putting that money towards trying to keep children in the home and making the home a safer place for children, to prevent them from entering the child welfare system. I think a lot of this will result in us not even knowing about the case, because if a child's not removed, it never goes to court, we never get appointed, we don't represent the parents, and hopefully the case closes before we ever even know it existed. And I think that is the most hopeful thing that can come out of this legislation, if the money is really being put towards keeping children in the home. I also know we're sort of in the beginning phases of trying to figure out what the freeing up of the Title IV-E funds will do for the system, and in my case, especially for parent representation, and to see where it can be put to the best use to help the process. But like I said, I think most of the money hopefully will be spent keeping it so I never even know about the case, and keeping the children in the home. The studies have consistently shown that children fare better either when they stay at home, or even when they're returned to parents who had abused them, they fare better than when they age out in a foster system. So if we can concentrate that money on fixing the family and getting the children home, I think it's a wonderful idea, and it's a great place to start with that thought in mind. So I'm very hopeful for it. I know that there's some challenges because the idea is to keep children out of group homes, but sometimes you just can't, and they don't want them to run out of funding. So I do know that there's going to be challenges with it, but it forces us to think outside the box, and it forces us to work a little harder to do what ultimately is best for children overall. Being removed is an adverse childhood experience that never goes away. And if you can stop that before it happens, then that is a great success.
Thank you, Candace. Phil?
I'd like to just piggyback off of Candace. She's spot on. The Family First Act is really driving systems towards what we've known as social workers for a long time, is that children do develop and grow more healthily when they are in familiar surroundings with familiar people. But as the Family First drives agencies like ours to remove kids from higher end care, group care facilities, and into family licensed foster homes, what we have to be mindful of, and Candace is right, that's where healing can be optimal. I say that with a caveat because I am so enamored with the over 150 foster homes that we license here in Brevard County, and the quality and depth of interaction and the unconditional love acceptance provided by foster families. But when you talk about family, the bio family and extension of, that's organic, that's natural. When we start ramping up critical mass of licensing family foster homes, we have to be mindful of the fact that they're going to need a lot of training. Our kids come with a lot of complexities, a lot of delays in development, a lot of overt and not so overt sometimes, and latent behavioral manifestations. And our families are going to need a lot of training and guidance and support. The good news is, though, when you think about what Family First is driving, it's saying that 50% of all services must be evidence-based. Now, I'm clinically trained, and I know the impact of not only having evidence-based programming in our communities, but it has to be done with fidelity and the right people. So I go back to an adequately funded system gets the best of the best in people who want to serve children and families. So with this evidence-based model being imposed upon us as being a must for at least 50% of those programs, I see a lot of good things happen. Evidence-based means empirically tested. When you think about what's empirically tested, you think about outcomes. And that's outcomes in diverting families from coming into the system, and outcomes about shortening the duration towards permanency. I hope to see much of this flourish, and for us to be an agency that continues to partner with agencies and programs throughout the county NFR to integrate those kinds of evidence-based programs here in Brevard.
Thanks, Phil. Alan, what are your thoughts?
In 2003, I was the chief legal counsel for DCF and negotiated the contract with Brevard. And I followed what Brevard's done through the years. And I think Brevard's going to actually have a little bit of a challenge. And because Brevard and the partnership has always believed in shifting resources to prevention. I recall early on, you created Brevard Cares, where all the referrals came from child protective investigators. And over time, and this was the goal, is that the community would know about it. DCF's label was not on the building. No one wanted it on the building. They wanted to see it as a community-based care. And now, more and more it's shifted. The family's getting help without that first hotline call even going, even the child being traumatized in the first instance. So, you know, you guys have had the statistics that have been in the top 5 the past 5, 6, 7 years, whatever. And it's because you use these evidence-based approaches. I think the biggest challenge is because the federal government dollars are not going to fund group homes. I don't think we have enough foster homes in the state. You know, thankfully we have Spencer Roach and Patricia Williams. They're going to take 6 kids each. That will help us out probably. But we have a real challenge because if the federal government does not fund group homes, and not that if we had foster homes, that'd be great, but we don't have them there. We don't have capacity. It's going to create a challenge given our budget issue. I see great hope for this. I see more families being together. It's aligned with the department's philosophy. But remember, Florida, before this new law came into effect, back in 2007, had started doing this. So where other states in the country are going to have a big benefit by reducing group homes, we've already reduced enough group homes in the normal course of things. So we have some challenges, but I think Florida can do it. And Brevard, you know, you guys have been there from the beginning, focused on the right thing.
Thanks, Alan. And since I got you, I'm going to ask you a couple questions. So what have your goals been as the executive director of the Guardian Ad Litem program, and specifically with regard to legislation through the years?
I would say the one word that summarizes our goals is normalcy. Now, we all know what normalcy means. It means families staying together. If a child unfortunately has to come into foster care, that we keep them there for as short as time as possible. That's not a normal life. But when they're there, we want them to have normal experiences. In fact, back in 2014, Florida passed a law called the Quality Parenting for Children in Foster Care Act, which created a situation so caregivers could make decisions for children as a reasonable, prudent parent can. And we were the first state, and they made it federal law the following year. But the goal is, it's normal to have a family and be there, and hopefully it can be the same family and you never have to come into care. But if you come into care, hopefully you can get the family back. But if not, we need you adopted. We need children to have families. And I think that what you see us advocating for are legislation through people like Patricia Williams, Spencer Roach, and many other legislators, because they care about children, of ways to find tools in the law to create better outcomes for children.
Thanks. And with decreased revenues because of the pandemic, what can we do to ensure we improve outcomes for children during this time and going forward?
I would say we look at efficiencies. We've heard it today throughout. How do we get these efficiencies? Well, you know, there's a lot on our plate, but I think we're learning a lot through this pandemic. You know, even if the Guardian Ad Litem program, we're going to save money by getting rid of some lease space. Some of our positions we realize can work from their home. That will save money. And I think a lot of this over the next couple of years is going to be how do we save money with improving our system of care. And telemedicine's a big example, but there's a lot more examples on how we do this. I've been watching court hearings through Zoom. And you know, I think we're getting the job done, and we're saving, we're finding ways to make it happen.
Thank you. And the Guardian Ad Litem program is a big player in the child welfare system throughout the state, but particularly in Brevard County, I think. There's some very strong leadership here. What are some unique things that you do in Brevard County that make you optimistic about what's happening here?
Well, as the executive director, I purposely placed 2 volunteers there by the name of Ben and Irene Abramowitz to make sure it works well there. Actually, I'm extremely proud of our volunteers and our staff there at the Guardian Ad Litem program. They do a great job, but they work in partnership with everyone. I love seeing Ella, the dog, I think Brevard's biggest strength is being focused on trauma-informed care. And I like what you guys have done with the youth, bringing them together in a leadership academy and letting them have a voice through this process. So there's a lot going on in Brevard. I think you're one of the leaders in the state. I remember when I was a state director at DCF and it came up with the feds, I'd always point them to Brevard, hoping they'd go there. You guys have a lot going on, and you have the county involved and partnerships, and I think you guys are headed in the right direction on everything.
Thanks, Alan. Representative Roach, thank you again for agreeing to be on the panel. So you're a leader in child protection policy. Can you tell us how that became a priority for you? I know that might sound like a silly question. Child welfare should be a priority for everyone, but please tell us how it became your priority.
Yes, thank you for the question. And you know, I consider myself a participant in the process. You know, really even more than a leader. But you know, I first got interested when I first moved to Lee County in the year 2000, 20 years ago now, and I started volunteering for Big Brothers Big Sisters. And I felt like that was sort of a natural glide path to more advocacy and more volunteer work. I ended up teaching a financial literacy class in law school to children that were aging out of the foster care system. And we saw that they were sort of, you know, really ripe for abuse by predatory lenders and other unscrupulous folks who, you know, as soon as they could access a credit card, they were just taking on mountains of debt that would plague them through the rest of their life. And then I've been a guardian ad litem now for almost 5 years. I've currently got 5 children that I'm a court-appointed guardian ad litem for. And last year I took another step up the ladder and got my foster care license. And I think maybe at some point I'll consider adoption as the next sort of logical progression here. But you know, I care about children. I think that any measure of a society's greatness is how we care for the most vulnerable members of that society. And, you know, Alan had mentioned the Guardian Ad Litem program a minute ago, and about recruitment and increasing, you know, active volunteers. And here in Lee County, we have about 2,300 children. I should say the 20th Judicial Circuit, we have about 2,300 children that are in DCF care. And we have about 50% of those kids, maybe a little over, have a Guardian Ad Litem. So you can see we're well over 1,000 Guardian Ad Litems short. And one of the things we have to do is encourage that volunteer work, that advocacy, and also with fostering. I think we really need to encourage more people to foster. And one of the things that I see too when we look at fostering is there are a lot of I'd say, you know, middle class and more affluent families that don't foster. A lot of that demographic that they might write a check to a charity, but they're not opening their homes in great numbers to foster. And I think that we need to target some of those folks and get them engaged to step up and volunteer and be foster parents. So that's also another goal of mine.
Thank you, Representative. And thank you for your participation as a foster parent and guardian ad litem on behalf of the kids. That's awesome. So you sponsored A Year is a Long Time in the Life of a Child. Why was that bill important to you?
Well, you know, I'd love to tell you that every legislator files bill based on an exhaustive and extensive review of data and analytics, and some of that is true, but a lot of what we do, at least a good portion of it, is based on anecdotal experiences and experiences that our constituents might have. And this bill was at least in part driven by my experience as a guardian ad litem. And we're seeing some of these cases drag on for 4, 6, 9 years, and these kids are languishing in the foster care system. And you know, Alan talked a lot about normalcy, and that's the goal. And virtually every metric that you look at shows that children fare better in almost every measurable category when they have the security of a permanent home. And that's what this bill was designed to do. It was designed to keep, you know, we have 24,000 kids right now in the state of Florida in the foster care system in some piece of that process. But this was designed to give judges, dependency court judges, a tool to shorten that process with the goal of having a parent show some substantial progress or commitment to their case plan within 12 months. And one thing I'll clarify about that, when you say 12 months, it doesn't mean that exactly on the 12-month day, the child is going to be, the parental rights are going to be terminated. What it does is it triggers a TPR hearing at that 12-month period, and the judge will still have the discretion and the ability to look at the case in context. And that's what the legislature wanted to do. We did not want to get into telling the dependency court judge what they had to do because these cases are so context specific. But what we do want to do is to trigger the parent's involvement in the case plan at an earlier start date in the process. That's what the bill was designed to do. And the good thing about our analytics and metrics, we can continue to measure that progress to see if the bill is making forward progress or if we need to tinker with it a little bit more going forward.
Thank you. Representative Williams, thank you again for agreeing to be part of the panel. Can you talk a little bit about the legislation regarding incarcerated parents and engagement of them?
Yes, this bill addressed the delay of permanency for children caused by failure to adequately involve incarcerated parents in any cases. When a child enters into the system, they get a case number. Each child in Dependency Coast would get that case number to identify the types of services that they would need in order for them to go home with their parents. And if a parent is incarcerated, they have certain things that they have to do while they are incarcerated in order to speed up the process of them going home, which could happen if a parent is ignored or not involved when the case plan is actually laid out. This will actually give incarcerated parents who are not making the progress on the case or aren't prepared to be reunified with their children. A child will be waiting in the system if the parents don't complete that task. And if they complete that task, they can go home with the parents faster. This delay or cause when the incarcerated parent is not ready to be unified according to what is handed down by the judge. So this will speed up that process and give the parents the opportunity to be part of that process.
Thank you, Representative. Can you also talk a little bit about the Pro Bono Matters Act?
Okay. The Pro Bono Matter Act, we have about we have attorneys that actually spend about 1.5 million hours providing services to children that's in the court system. This will actually give the children that have special needs, their court fees will actually be paid in order for the attorneys who are willing to volunteer their time and not pull money out of their pocket.
Thank you. And you're also a foster parent, is that correct?
Yes, ma'am.
Thank you. Thank you for being a foster parent. And a guardian ad litem?
Guardian ad litem, and I adopted one of my foster children last year.
Thank you so much. One more question for you. What are your goals for the upcoming years in child welfare?
I would like to be able to help with the children that's aging out of the system, to actually give them a career path, to partner them with other people that has been through the system, that could make a positive impact on them, to be able to work along with them and show that even if you started out with a rough time, it's not how you start, it's how you finish. Work along with them to make things happen, to show that a career path is there to be laid out for them.
Well, thank you so much for everything you do for our kids. Zach Gibson, thank you again for agreeing to be part of our panel.
Sure.
So you've done a tremendous amount of statewide advocacy to promote resiliency. Why do you think it's such an important topic, and how do we promote it better through education?
Thank you for that loaded question. I think resiliency is at the core of what we're all trying to achieve, right? Our ability to manage and deal with stress in a positive and appropriate manner is for some easy to do when you have support systems and resources at your disposal, whereas for others it's very challenging. And just even the concept of talking about resiliency could be well over somebody's head who's dealing with so much that they are unsure what to do in those situations. But I think when we speak about education, it really talks to, I think, where we're trying to go as a state in enhancing our prevention efforts. To build off of the previous speakers regarding the Families First Prevention Services Act, the idea that we're even becoming more definitive in talking about prevention is a step in the right direction. And certainly, too, how are we moving upstream to be able to capture and identify those families who are having challenges, to be able to provide the supports and assistance needed so that they never come to the attention of the department or other, agencies, DJJ in particular, corrections. But that not only do we prevent that from happening, but that we are also helping build the resilience within those families so that when they experience stress in the future, they know where to go or who to talk to be able to seek the assistance or support that they may need that can keep them on a pathway towards becoming productive and self-sufficient.
Thank you. I appreciate that. And how does the faith-based organizations help us with that?
I think there are many opportunities for faith-based organizations to help with that. Currently in our state, we have a statewide faith-based and community-based advisory council that's responsible for enlisting, equipping, and expanding the work of faith, volunteer, and community organizations to work with government to improve services for Floridians. So that's one aspect that we have. Last fall, Governor DeSantis appointed a liaison, Mr. Eric Dellenbeck, to lead the governor's faith and community-based initiative. We're excited about that because Eric also serves as a member of our advisory council. And certainly the mission is the same. How do we build the partnerships with our faith community to help them know what are the needs within not only the child welfare system, but just within systems overall, and what are the opportunities they can play in providing supports, whether it be materialistic support, emotional support, spiritual support. I think there are many opportunities because what's unique about the fact of government and faith is that we have a kind of similar pathways that we're on, right? We're serving the community. We have a common mission to serve those who are in need. And I think by recognizing that, how do we better identify the work that they're doing, what we are doing, where are the opportunities to collaborate, to possibly blend and braid our approaches that can be meaningful for lifting people up.
Thank you. And finally, as we work through COVID-19 pandemic, what does child abuse prevention look like now? And what do you think it'll look like in the future? Are there challenges as a result of the pandemic?
I think absolutely. I think there's been a lot of concerns raised around the safety of kids since our #1 reporters of teachers with schools being closed. There's less eyes on kids, so there's certainly great concern around what may be happening behind closed doors since there are less people seeing what's going on. I think as we think about what child abuse prevention looks like, it's certainly going to look different because we are so accustomed to the in-person engagement with families, with individuals, to make those connections. And now that with COVID-19, social distancing, and all the factors that are at play, we have to become very creative. And as we are all aware, Zoom, Microsoft Teams, whatever platform you're using has become the go-to for connection. But I think in light of that, I think for many of us, we're still missing that. We're missing that social interaction, the ability to look at someone face to face, to read body language, to get those other cues and indicators that help us in building connection and relationship with others. So I think we're going to have to continually be creative in how we look at child abuse prevention moving forward. And certainly education and training is a key component to that. I think it's also a part too of our agencies really coming together, continuing to come together, and really exploring opportunities of how do we further refine, improve, and strengthen our efforts that are meaningful to serve the people that are most in need.
Thank you, Zach. And Candace, thank you again for agreeing to be on the panel. You recently worked on some legislation. Can you tell us about that?
I love that you're asking me this question now because yes, I have worked on legislation since I got appointed in 2016, but this past session was the first time with Alan's encouragement. I came up with my own idea where I saw something that needed fixing, and I started with the idea. I brought it to some legislators and they liked it, and ultimately was signed into law. And it was HB 197. Sponsored by Representative Payne and Senator Bean, and I'm so grateful for them for listening to me. My first time trying to get my own piece of legislation passed. I called it Patriot Parent Protection Act, but really what it is, it codifies what already exists in federal law called the Service Member Civil Relief Act. It exists in family law, and it's meant to apply to all laws to protect our patriots. They do have special protections by federal law, including in dependency cases. So when somebody's serving their country and their child gets taken, this requires the department to observe the protections of the act as intended. The parent cannot be charged with abandonment by virtue of their service, and it can't be used against them. And also it gives them that time to be able to appear in court if needed, or complete services if needed, without holding the time that they're serving our country against them. So it seemed like a no-brainer, and apparently the legislators agreed. And so I dipped my foot in the pool there and was so happy that that the governor did sign it into law now, because it's important. It protects parents, it protects children, and it protects our service members. So I couldn't be more proud and happy that that legislation went through.
Thank you, Candace. I like that legislation too. I'm glad we're protecting our veterans and our service members. So what have you done to improve collaboration between parents, attorneys, the Department of Children and Families, GALs, CBCs, all the players? Because I know you have work to do that.
That's a big question too. And certainly that is a goal always, to improve the collaboration between everybody working together in the system, because we are all working together. And again, Alan and I, ever since I started this job, he came to me with things that he was working on and wanted to know what parents' attorneys thought of it. And I'm more grateful I could not be for that, because we always want to have some input in that legislation from our perspective, from the parent attorneys who are in the courtroom with parents every day. And we don't always agree. Don't get me wrong. We certainly don't see eye to eye on everything, but we seem to be able to come to a lot of common ground that really never existed before. So just being able to open those lines of communication has been wonderful. I'm with the department too. There's a lot more players with the Department of Children and Families, so that's a bigger challenge. But still, utilizing the people that we already communicate with every day, like the Guardian Ad Litem program, has helped. Also, just being involved on the steering committee for children and families in the courts and the dependency court improvement panel, and just making sure that not only are our voices heard, but we come to some sort of compromise position. And it's been really great to be able to do that in ways we never have before, and being able to sort of duke it out before things become law has been a great thing.
Excellent, thank you. And I think it's pretty clear that when we have parent engagement, we have better success for our families, especially with regard to reunification. Bill, thank you for being part of the panel too. And can you talk a little bit about the faith-based community and strengthening those connections in Brevard County?
Well, what wouldn't I do to engage our local churches? Well, I pride myself in being a servant leader. And I think if you saw earlier, I had a new strategy. I thought I would get with a local church, allow a canine to pull the socks off my feet, to gather the attention of onlookers to see if they will gravitate towards that willingness. But by the way, I asked the audience not to sell that clip online until you speak to my agent. But in all seriousness, when I came on board just shy of 2 years ago, one of my first treks was to Tallahassee. And then when I was in the Capitol, I ran across Chad Popple, the Secretary of the Department of Children and Families. And he walked up to me and he said, "Hey, Phil, you guys involved with the churches?" Now, it was just a passing conversation, but I could have talked his ears off into the night, because Brevard Family Partnership really is proud in the sense that we can say that the church has been and will continue to be an integral part of our system of care. It was shortly thereafter that I attempted to make time with the governor, and I actually had the privilege of speaking with the First Lady, and she was talking about, he and she wanting the community to really embrace the faith community. So I said to them, I said, this has definitely been on our radar. It's been a part of our history. And if you think about it, we have testimony from our dependency case management folks that the churches have stepped up many a time before to work towards the reunification planning and the readiness of moms and dads to get their kids back by coming together as a community and providing resources to reestablish their homes to be a safe place. I mean, so when we see these things happening, we know the interest is mutual. Our churches, we've got like 450, almost 500 churches throughout Brevard County, all ready, willing, and able to open their doors and their congregation to partner with us. We have a number of holiday events and back to school initiatives. By and large, they're front and center. They're providing us space. They're providing us volunteers. They're providing us resources. They help with the capital campaign of providing the material goods for these children as they return to school. They've always been a voice and advocate and contributor to the fostering recruitment initiatives of our organization. I can go on and on about the space and the resources that they provide us because they do want to partner. We even have within our own organization a HUGS program, which really prides itself on a just one initiative. I mean, if you think about the hundreds of churches, and if every church took on a child in foster care, the resources would be in abundance. So, to say what we're doing and what we're going to do, for me, it's to get to the senior leadership of the churches. It's already begun. I mean, I've even taken the liberty to create a position at Brevard Family Partnership, which is faith and community-based liaison. And we are scheduling one church after another to roll up our sleeves. I said earlier that I've been doing this for many, many years. One of the things that I observed when engaging churches is they too have their needs. They have their financial challenges. They have a focus on building congregation. I always meet our partners in the middle of the road to say, what would the ROI, the return on their investment be in partnering with agencies that's community-based? And I think, wouldn't it be great if you engage the church community to the cause of working with vulnerable children and families, and at the same time help them build congregation? There's been many a study about families who get involved with taking in children and working with the families. So many of us who do that have a very strong faith background. I really believe it's the faith community that has a calling and a place and purpose to unite with us. We had been a part of the City Fest event that occurred earlier this past year. And I was so proud and privileged on behalf of the organization that I'm privileged to lead to have a platform to speak about the need for more foster homes this coming year. And there were over, I think, 150 church leaders present locally here in Melbourne to talk about how do we rally behind the cause of the fostering need. It was wonderful. One of the last things I want to leave you, Kelly, is that I have begun a journey with our wonderful agency. We have over 200 folks, and I am blessed. I get to go to work every day to work with people who are endlessly committed, and they're so astute at what they do. They're truly the experts about working with vulnerable children and families. But you need, like we said earlier, evidence-based models. And I'm working with an open table model that I'm looking to integrate with the help of the churches because its origins are within the church community. I have found a way and a vehicle and a vessel by which engaging the church with a platform, tools, guidance, and support so that churches can begin to open tables to the community of natural resources to help families that are at risk, help families that are struggling, some right there within their own congregation. So all of this is happening simultaneous. Our organizational commitment to make the faith community a priority one and a stakeholder among stakeholders has ever been so strong. And I'm so proud to stand behind that.
Thank you so much, Phil. Representative Roach needs to leave, so I was going to ask if he wanted to make a final comment.
Yes, thank you so much, and thanks for having me again. two quick comments, if I may. One, Phil had mentioned in his last statement about some of these informal arrangements, and I just wanted to give a quick shout out and a plug to Alan Abramowitz and to Senator Aaron Bean for the bill that we all worked on last year and passed unanimously through all three committees in both chambers and on the chamber floors, and signed into law by the governor, despite some very zealous opposition to extend the definition of extended family members to include fictive kin. To allow for some of those more informal arrangements to take place and encourage folks to stay out of the system when they don't have to enter it. And then second, Chairman Ponder, who chairs the Children, Families, and Senior Subcommittee, the very first time that I sat in that committee with him, he referred to that committee as a gateway of hope, and it is. And I am hopeful, I'm optimistic, I'm honored to be in the company of all of you who are dedicating your careers to helping the most vulnerable citizens among us. But I want to be very realistic and pragmatic that I believe that we are living through a time that historians will be writing about for the next 100 years. And I think we are entering a period of unique and enhanced vulnerability for our children, compounded by a couple of things. As I think Phil or Zach had mentioned, a lot of our most frequent reporting sources, doctors, nurses who may be seeing more of these children virtually, and then our teachers who may not be seeing them at all, don't have eyes on these children. As a guardian ad litem, I am also prohibited from visiting my children right now in their placements. And we all know that one of the key stressors on families in domestic incidents and child abuse is economics. And as I mentioned earlier, we've just seen the largest economic quarter of contraction we've ever seen in the history of the United States. So I think all of those factors combined with the revenue reduction are going to put us in a very challenging position, and it's more important than ever that we be zealous advocates for these children. And I want to thank you all for doing that. I look forward to working with everyone the next legislative session, assuming that I return to Tallahassee in November. So thank you again for having me.
Thank you, Representative. We are out of time for the panel, but we are doing our Child Abuse Prevention Task Force Awards, the annual awards. They'll be virtual for this year only, I hope. But thank you all so much for agreeing to be on the panel, for participating, and for your wonderful comments.
We foster hope every day when we work with one another by being strength-based and valuing and appreciating the work that we do. Most of us come into this field because of our passion and because we find meaning and purpose in this work. These jobs can be one of the most fulfilling and gratifying work experiences that you'll ever have. And I feel honored and privileged that every day I can work with all of you where you are imparting hope to families.
As we bring this Brevard County first time virtual event to closure, I want to personally thank everyone who's contributed to the effort, bringing this community together, engaging the professional community to come and talk about and share all of the resources that we have coming together. I'm so impressed with what I've seen with the therapeutic interventions through animal therapy, through the resources that are provided through our judiciary, with our representatives voicing their perspective and their commitment, and then the agencies that have come together to share and exchange dialogue for the greater good of moving forward. That's what brings me hope. It brings me hope to think that we can do this in spite of the time. This whole COVID experience has not divided us in any way, has not put us in a position of submissiveness. In fact, we've gotten stronger. We've come together and realized that not only can we come together, we can really unite in a way that will advance us towards serving this greater community of Brevard County in a way that will yield tremendous returns on the investment of coming together as a community. So with that said, I am so grateful for everyone's participation. I'm so grateful for you, the viewers, for being cognizant of how important this is to understand, indulge, and process, and hopefully bring home to our own families the dialogue about how communities can come together through great adversity to help those that are less fortunate. So thank you once again, and God bless you all.